Hello, I'm Mark Belue of Belue & Associates, LLC, an employee benefits firm in Harrisburg, North Carolina. Are you shopping for medical insurance? Most individuals are familiar with traditional PPO type medical plans with copays, deductibles, and out-of-pockets. But are you up to date on the advantages and disadvantages of an HSA, a health savings account? This quick video is intended to outline the advantages and disadvantages of a health savings account versus a traditional PPO medical plan. First of all, let's clarify some terminology. What most people call an HSA, or a health savings account, is actually the bank portion or the savings portion. The underlying medical plan is a qualified high deductible health plan. That is what's sold to you from an insurance company. That is the medical plan. In order for you to make contributions to a health savings account, you must be covered concurrently under a qualified high deductible health plan. Many carriers offer options for you to buy the qualified high deductible health plan through them, an insured product, and remit extra premium to them, and they will put that into their company sponsored health savings account. But that's not necessary. You can choose your own bank or credit union to make those deposits. There are tax advantages to making contributions to an HSA. You need to consult with either hsa.gov or your financial or tax advisors for that. It's up between you and the IRS for you to spend the dollars that you put into an HSA in the proper manner for those expenses and those tax deductions to be qualified. Okay, enough of the preliminaries. Let's look at a test case. I just got off the telephone with a person that I know in one of the groups that I insure for group insurance. There's a man there, and he wants to cover his two daughters who have aged out as eligible dependents. He's going to pay the premium, and he's wondering what kind of plan that he should buy for them. I showed him both the HSA and a traditional plan. I'll use those numbers in our example. This particular carrier breaks their plans down, their traditional PPO plans down, into Plan A, Plan B, and Plan C. They also have an HSA offering. The most popular plan is not Plan A or Plan C, it's Plan B. Most people choose a $2,500 calendar year deductible. After the deductible, the plan goes into co-insurance. That means that two people are insuring, yourself and the insurance company. The insurance company picks up 70% of the discounted expenses, and you pick up 30% of the discounted expenses until your 30% reaches an additional, over and above the deductible, $3,000. The deductible does not need to be satisfied if all you're doing is going to the doctor. In this case, you can go to the primary care doctor for $25, and you could go to a specialist for a $50 copayment. You can also use a prescription drug plan, but on this particular plan there's a $200 deductible just for the drug card before you get the privilege of paying $10 for generics and $35 for their preferred brands. Now, let's look at this plan and look at the total annual cost and the potential total annual liability. This plan for this particular individual is about $160 per month. This particular insured is a smoker, so that adds 30% to the cost, 30% on top of the $160, which brings us to about $208 per month before we even consider any of her health questions. Here's just the quoted rates going into the application process. That premium, $208 annualized, is $2,496 per year. So just note that. Round that up to $2,500. In a worst case scenario, this person would have to go into the hospital and pay a $2,500 deductible. Then the plan goes into co-insurance. As I said before, the plan pays 70% and the insured pays 30% until the insured's 30% reaches the plan's out-of-pocket limit, which is an additional $3,000. So in addition to the $2,500 premium, the insured is faced with a $2,500 calendar year deductible, in addition a $3,000 out-of-pocket limit. The total liability for this plan, not counting copays that don't accumulate towards anything, or the $200 prescription drug deductible, or the prescription drug copays after the deductible is satisfied, not counting any of those things, the total liability is $2,500 for the annual premium, $2,500 for the deductible, and $3,000. That totals about $8,000 per year. Now let's look at what we'll call the HSA. I know it's a qualified high deductible health plan, but that's a lot to say, so let's just call it an HSA. The HSA premium is $82.74 per month. That's a $5,000 deductible, and after that, everything's paid at 100%. Let's round that premium up to $83. And remember, she's a smoker, so you have to add 30% onto the $83. But because the premium is so much lower, it doesn't cost the insurance in terms of dollars so much more money. Because if you're applying 30% to $160, it's a lot more dollars than applying 30% to $83. So the total premium will be about $108 for this insured under the HSA plan. 108 times 12 would be $1,296. Let's just call that $1,300 for the year. On this particular plan that I've quoted this individual for his daughter, the calendar year deductible is $5,000, but after that everything's paid at 100%. So let's look at the total liability. First of all, we have a premium of about $108 per month. Annualized, that's about $1,300 per year. Then, under this plan, it's very simple. There are no copays for office visits. There are no copays or separate deductibles for prescription drugs. There's just one $5,000 deductible. So the plan's liability for the whole year is $5,000. The total liability would be $1,300 plus $5,000, which is $6,300. Remember, your total liability under the traditional PPO plan was about $2,500 annual premium, plus a $2,500 deductible. That totaled to $5,000, plus a $3,000 out of pocket. That's about $8,000. Under this plan, your total annual premium is about $1,300, plus a $5,000 plan liability, totaling to about $6,300. That's a significant savings under this plan in the worst case scenario as compared to a traditional PPO plan. What is a good strategy behind owning a health savings account type plan? The best strategy, if you're considering buying an HSA type plan, is to pay the insurance carrier their premium for the qualified high deductible portion of the plan. You'd pay them, in this case, $108 a month. But you would set a budget to pay up to the cost of the traditional PPO plan, which in this case is $208. So the difference being $100. So the best strategy is to pay $208 a month, even while you're buying the HSA, but you break it apart. You pay for the qualified high deductible health insurance part, $108, send that to the carrier, and then the remaining $100 you send to yourself, and you deposit that in your qualified HSA account. And you do that every month. You save $100 a month, and at the end of 12 months, you've accumulated $1,200. So let's say that you get into this HSA type plan, and 3 months down the road, you need to go to the doctor. Well, you know, under this plan, there's no copay. You got a $5,000 deductible, but you've been judicious and disciplined about putting that $300 into your HSA account. That's a bank account. You got a debit card there. So what do? Well, let's say your carrier is Carrier A, and Carrier A has a network, and you go to a network physician, and the normal retail non-PPO discounted cost for going to the physician for a typical visit is $200. Well, since you're going to a network physician with Carrier A, they're going to discount that visit to, say, $100. Well, you have $300 in the bank in your HSA account. So when you get the net cost from the insurance company, you'll get an explanation of benefits from the insurance company showing that you've gone to the doctor and your PPO discounts have knocked the cost down, your liability, from $200 to $100. You pick up the phone, you call your doctor. On the billing number, you have your HSA debit card in your hand, and you just pay your $100 out of your HSA account over the telephone, and the job's done. What happens if they prescribe a prescription drug? Well, in our scenario, you've gone 3 months, you put $100 a month in, you owe the doctor $100 for the visit, you've got $200 left. Do you think you can manage to buy a generic drug with $200? Well, consider generics. Remember, generic drugs have to be passed by the FDA, same as name brand drugs. All generic drugs started off being name brand drugs. So about 70% of name brand drugs have a generic equivalent. So try generic. When you're in the room with the physician and the physician's making a decision to prescribe a drug, bring up the cost factor. Say, Doc, I'm just not an unlimited body of money here. I'm paying my own way because I have an HSA. You're prescribing an antibiotic. How expensive is that? Is that costly? Is there a cheaper alternative? I don't have to have the best, most recent TV drug that you see in 30-second ads on TV costing billions of dollars, prompting people to buy those drugs. Those are expensive drugs. Is there a less expensive alternative that you can prescribe for me that you feel good about? A lot of times, older drugs have very good clinical outcomes with fewer side effects. So ask them, I'm not a physician, and you may even just ask them, say, doctor, is there something that you can do that will help out my pocketbook? This is called consumerism. Now, if all you're doing is buying a medical plan where you've got copays, you don't bother asking the price because your price is the copay. You could care less about the price. But you do start caring about the price when year after year medical costs start going through the roof. If you had a fixed price to pay for a tank full of gasoline every time, you could care less about a gasoline cost. But you don't. You have to pay, so you're aware of what gasoline costs, and you shop around for the best price. Another very valuable resource is your pharmacist. Pharmacists are highly trained medical professionals. They have almost the same medical training as a physician. Talk to your pharmacist. Get a personal relationship with a pharmacist. Ask your pharmacist for his or her advice on how you're being treated and the drugs you're being prescribed. There's only certain things they can tell you, but there's a wealth of information with your local pharmacist. Utilize your local pharmacist. They're an excellent resource. To review, the advantage of a traditional PPO plan is it's relatively simple, and it has copays, so you don't have any front-end risk associated with not having copays. A disadvantage to a PPO plan is that if you don't use the plan a lot, you send all your money to the insurance company and you start all over the next year. Typically also, renewals for these type plans, traditional PPO plans, are higher, and since the premium is higher, the higher renewal on a higher premium is higher dollars coming out of your pocket. Also, if you're rated up because of health conditions, or in this case, if you're rated up because of smokers, since the premium itself starts off high, being associated with a traditional PPO type plan, then the dollar amount increase initially for health conditions and annually for renewals is also higher. In this particular case, this traditional PPO has a $5 million lifetime major medical maximum, and that's usually enough, but there is a limitation, and some people are a little skittish. They like an unlimited maximum. The advantage of an HSA is that you have lower premium, and you have an opportunity to pay the difference of the premium to yourself and become a consumer of health care. If you don't use the plan a lot in a year, you get to keep all the money that you saved. But even if you do, even if you have a terrible year, if, as we've illustrated before, the total liability for an HSA plan for this particular case and for most cases is less when you add up the total liability of the plan, the deductibles and the out-of-pockets, and the annual premium, and compare it to the total liability of a traditional PPO plan. The annual premiums being higher, the deductibles usually being high, and the out-of-pockets being high, not to mention the copays and things like that. So there are also tax advantages to the HSA plan. Finally, another huge benefit for an HSA type plan is that a preventive office visit is covered at 100%, no deductible. Now, you might be saying, well, that's the case under a traditional PPO plan as well. It is, but you have to pay the copay. But under the HSA, there's not even a copay. Now, the only thing you have to be careful about with an HSA and preventive benefits or visits is that you might intend to go in for a preventive type visit, but the outcome of the visit might be that they find something wrong with you. So the outcome is that your visit is actually coded to the insurance carrier as a diagnostic type visit, even though intended to be preventive. In the final analysis and the final reporting to the carrier, it's diagnostic. So in that case, it would not be paid at 100%, and it would apply to your deductible. Finally, if a person really understands and starting to get the HSA concept, but they just can't get over that high front-end deductible with no copays, that's very understandable because you've been taught to use copays over the year. There are special IRS rules. You can check with your financial advisor or the IRS about this, but there are special IRS rules that if you have a qualified IRA, you can actually transfer that money from an IRA into your HSA one time at the beginning to get yourself started. And finally, speaking of an IRA, an individual retirement account, your HSA can actually function as an IRA when you head into your retirement years at age 65. Prior to age 65, your HSA monies need to be spent on qualified medical expenses to avoid taxes and penalties. But after 65, you can actually pull the money out and use it as ordinary income, similar and really exactly the same as your IRA. There are taxes to be paid on it, but not penalties. The IRS also allows you to use the money to buy long-term care insurance. I hope you've enjoyed this presentation. I hope you can understand a little bit more of the differences between a traditional PPO and a HSA plan, and I hope that you have a good outcome in your health insurance shopping. If you need us, please call us at the information provided above.